Hi, my name is Dr. Christopher Segler. I'm a toenail surgeon in San Francisco, and today we're going to talk about ingrown toenails, how you cause them, and how you can fix them. The first thing you need to know about ingrown toenails is that you can prevent them. Just make sure that when you cut your toenails, you cut the toenails straight across. Don't cut them at an angle or curved. Also, don't cut them too short. That's one of the best ways to cause an ingrown toenail. You also have to make sure that you have enough room for your toes so that the corners of the toenails don't get pinched and start an ingrown toenail. Ingrown toenails aren't really caused by high-heeled shoes, but they can be caused by shoes that have a particularly tight constrictive toe box because it pinches the corner of the nails and can start it to become ingrown. Rock climbing shoes are a perfect example of this. Many climbers wear shoes that are 2 sizes smaller than their street shoes in order to get a snug fit. However, that can often pinch the toes and lead to an ingrown toenail. Kids often get ingrown toenails from playing soccer. Many times the culprit is actually the shoes that were worn last season that still fit even though they're too tight. When kids wear these tight shoes and kick the soccer ball, it can easily start an ingrown toenail. But without a doubt, the most common cause of ingrown toenails that podiatrists see is from patients who actually cut their own toenails but cut them wrong. The way this happens is that the toenails get cut just a little bit too short, and then the corner of the toenail starts to become ingrown or hung up in the skin. You can see that illustrated here on the upper right corner where the nail is stuck in the skin. The dotted line actually represents the border of the nail that's not really visible way down in that toenail groove. During the very early stages of an ingrown toenail, it's often possible to soak the foot in warm soapy water. That can oftentimes soften the skin just enough that it will free the nail so that it doesn't actually become worse and doesn't become ingrown. Unfortunately, many patients will go after the ingrown toenail themselves in what podiatrists often refer to as bathroom surgery. They decide to try to cut out that piece of toenail and see if they can remove it to get it to go away quickly. By trying to cut out the corner of the nail, they stick nail nippers down in the corner, as you see illustrated here, and they snip it and try to get that triangular piece of nail out from the toenail. But what you can also see here is that a portion of the nail is hidden down in that nail groove and it's not snipped completely. So then the patient has to jerk on it and pull in order to get that piece of nail out of there. Of course, then they pull out a small triangular piece of nail, as you see here. It feels better because it's relieved some of the pressure. But what you can also see is that hidden down in the nail groove in this illustration is a little pointy piece of nail that doctors call a spicule. And that spicule is a disaster waiting to happen. But you can't even see it because it's hidden way down underneath the fold of skin at the side of the toe. Now that spicule will continue to grow with the rest of the nail plate, and then if you bump into something like a coffee table or a door jamb, the spicule can actually stick right into the skin in the end of the toe. Then the toe becomes inflamed and that skin grows right over the end of the spicule and causes the severely infected and inflamed ingrown toenail. That's when the patient shows up in the doctor's office with an extremely inflamed or infected ingrown toenail that just can't be relieved on the patient's own. Once the nail is actually stuck in the skin and the skin has grown over the nail, there's really no way for you to remove this at home. At that point, you really need the assistance from a toenail surgeon who's been trained to remove ingrown toenails without causing any damage or any additional pain. A very simple procedure can be performed where the border of the nail that's actually become stuck in the nail groove can be removed. This provides immediate relief of the pain because we actually numb up the toe before we do the procedure. Patients often feel tremendously better the next day, far more when they first had the ingrown toenail and certainly when they showed up at the doctor's office to have it removed. This is a procedure that provides a huge amount of relief, and fortunately for you, it's one we can actually perform in your own home. In fact, the podiatrist can actually come right to your house and remove that ingrown toenail. In San Francisco, we can actually have the podiatrist in your house and have the ingrown toenail removed in less than an hour. Imagine complete relief from that ingrown toenail 1 hour from right now.